Greetings, everyone. My name is Dr. David Hardwig, owner of Atlas Health and Wellness. And today I'm going to talk about something that is near and dear to me, and that is helping people lose weight. I say that in air quotes because losing weight isn't always necessarily what we're trying to achieve. If individuals have obesity to a level that weight loss is good for them, obviously we want that. But as a disclaimer, muscle weighs more than fat. So oftentimes it can be difficult for individuals to perceive how well they're doing in terms of their weight loss when it comes to their attempts to try to lose weight. And I want to talk to you about this because in my 12 years of clinical practice, I have seen so many people injured trying to lose weight in good faith. They, go out and they get a trainer or they join a gym and they put their heart into shedding the fat. And I say shedding the fat because I want, when an individual is obese, size matters. So losing waist size is almost as important, if not more important, than losing weight. So what do I mean by that? I mean, when you strength train, you will put on muscle mass. When you put on muscle mass, that may not change your weight. And so it's a vicious cycle. Our culture is so focused on weight loss instead of size loss. But I don't want to get into the weeds. I was a personal trainer at the age of 19, and I was really inspired to help people shed weight, or shed size, I should say. And I ran into a problem, and that problem was being able to help people who were obese was very difficult as a trainer because many of these individuals had underlying arthritic problems or inflammatory problems associated with movement deficits, which is what physical therapists do. And that's what I ended up doing. I went on to go get my doctorate in physical therapy at the University of Maryland Eastern Shore and graduated in 2010. Again, I worked in orthopedics for 12 years, and I was helping treat inflammatory problems that resulted from regular activity, sometimes not regular activity, sometimes it was sedentary things and overuse injuries. But I'd say at any given time, a third of all my patients were created through the process of exercise. And many of those individuals were obese. And so I pulled up, this is the CDC's website, and some of these statistics are probably worse than they are currently. After the pandemic, I saw most patients gain anywhere from 30 to 40 pounds of fat, not muscle. In fact, they had more muscle wasting as a result of being locked in their homes and avoiding the gym than I'd ever seen before. It was terrifying how many people were unwell, physically unwell, cardiovascularly unwell. The pandemic did, in my opinion, more harm to the general populace. The lockdowns, I should say, did more harm to the populace than the disease itself. And others would argue differently, but I'm going based on my clinical opinion and what I saw in the aftermath of 2020. Anyway, so this data suggests that from 2013 to 2016, 49% of the U.S. adults tried to lose weight in the last 12 months, meaning that half of the U.S. population tried to not be obese anymore. A higher percentage of women than men tried to lose weight, and a lower percentage of non-Hispanic Asian adults than non-Hispanic whites. That stuff that gets in the weeds. The percentage of adults who tried to lose weight increased with family income and with weight status category. Among adults who tried to lose weight, the most commonly reported method were exercising, 62.9%, eating less food, 62.9%, followed by consuming more fruits, vegetables, and salads, 50.4%. Almost 40% of adults in the United States had obesity in 2015 to 2016. And I would argue that number has increased dramatically. Individuals may have multiple motivations in trying to lose weight, including health, appearance reasons. This report describes the percentage of U.S. adults who tried to lose weight in the past year by sex, age, race, Hispanic origin, family income, weight status based on data collected in the National Health and Nutrition Examination Survey, NHANES. I love their acronyms. Okay, so kind of went over that already. I don't care about that. Not that I don't care about, I don't care about race or that I want everybody to try to be healthy. The politics of picking race is, I think, foolish and counterproductive, and separates us as a culture. Where are the differences? Okay, were there differences in the percentage of adults who tried to lose weight by family income? Of course, there were. People that make more money are more health conscious, and better educated typically. Were there differences between adults? All right, the percentage of adults who tried to lose weight increased with weight status category over and among men, both overall and among both men and women. Overall, 66.7% of adults with obesity and 49% of overweight adults and 25% of underweight or normal weight adults tried to lose weight. Within each weight status category, a higher percentage of women try more than men. Okay, so most people, and the story goes, is most people try to lose weight through exercise and eating better, okay? Here is where Atlas Health and Wellness plays an important role in helping people lose weight, or I should say lose size. Your musculoskeletal system burns calories typically through muscle contractions and physical activity. The less muscle mass you have, the less calories you burn. In fact, people that are morbidly obese can actually lose size faster than someone that is, quote, just overweight or obese. And that is because morbidly obese people have lots of muscle mass because they have to move their bodies through space, and their bodies are bigger. So their muscle mass is usually bigger to accommodate that frame. So at Atlas Health and Wellness, we are not treating inflammatory problems like your traditional physical therapist. We are helping in prevention of inflammatory problems. So if you are overweight and you are seeking to change your life for the better, I created Atlas Health and Wellness for you. I got so tired of watching people become injured, going with trainers, going with fitness gurus that promised you the world. Okay, that they could just push you until you lost the weight. Well, this is what usually happens. You go with a trainer or you go with your self-motivation, and you don't know what muscles are weak. And when muscles are weak, they're not going to burn calories as effectively. Not only will that weakness result in less caloric burn, but it will also result in joint damage and the development of osteoarthritis. Again, I mentioned that as a personal trainer, most of the clients that I was seeing had obesity and had underlying orthopedic and arthritic conditions that required physical therapy, even while I was working with them. And I didn't know what to do with them. I just, oh, that hurts. We just won't do that, and it's a pot shot. So arthritis is a slow creeping progressive disease that is very manageable and preventable if you know how to calibrate the musculoskeletal system. We at Atlas Health and Wellness, we use amazing software to measure your strength and over time. And with this, we can identify deficits that could potentially lead to inflammatory conditions of the back, the knees, ankles, the shoulders. We don't want you to hurt yourself, because this vicious cycle, you get hurt, and your attempts to exercise in the new year, your New Year's resolution is to lose that 15 pounds or fit in that new dress. And here we are pushing it hard as we can and inflaming our joints to the point where it prevents you from exercising. And that is so frustrating for people that are well-intentioned in what they're trying to do. If you're curious about what we are doing here at Atlas Health and Wellness, give us a call at 954-932-8527. If you got questions, you can reach out to it us at info@atlashealthandwellness.com. My name is Dr. David Hartwig, and I'm here to empower you to shoulder the weight of your world. We look forward to meeting you soon.